I commit to them and our system commits to them that we're doing everything we can to make the care safer and safer.
Dr. Paul Kortz is the Chief Medical Officer of the Defense Health Agency, the organization that oversees medical care for service members and their families. He's sitting down with our National Investigative Team for the first time following our years-long investigation, digging into medical malpractice in the military system.
My heart breaks for patients who have had complications and unintended outcomes as the result of our care.
Those unexpected and tragic outcomes have impacted the lives of thousands of service members and their families across the country.
This was him the morning of his surgery, and this is how they returned him to me. They failed him.
I know she didn't want to die. She had a family, she had kids, she had a husband.
But the DHA has been reluctant to answer wide-ranging questions about how mistakes, mishaps, and malpractice are handled, until now.
I think we've been very aggressive about being transparent.
Our investigations have found transparency is hard to come by, with people forced to fight to get information about how their loved ones were seriously hurt or killed in military facilities, and the identity of the providers involved withheld.
Our reporting has uncovered hundreds of reports about military physicians and medical providers made to a confidential databank that tracks discipline, lawsuit settlements, and malpractice payments. Hundreds of suspensions and other disciplinary action taken against providers following mistakes or misconduct, and nearly $1 billion spent on malpractice claims filed against military doctors in the last 15 years.
Despite serious discipline and big dollars spent, the names of all those problematic providers are kept confidential by law. In the civilian world, that's not the case, with state medical board websites often listing discipline and malpractice payments. But in the military secretive system, patients are left in the dark.
If the goal is transparency, why not disclose doctors who have been disciplined?
Well, as I said, we follow federal regulations.
See, if they're outside the military system, they can look up whatever they want. If they're inside your circle, they can't do that. Does that feel right?
As a surgeon, what feels right to me is having a conversation with my patient. This piece about transparency is near and dear to my heart. Being transparent with the patients, we can certainly think through, not that more can't be done necessarily, but I think we've been very forthcoming with respect to the information that we have made available to the patients. But
it's not specific. It's statistics, it's policies.
Yes.
It's not something that can help me at the ground level make an informed decision about my health care. And so to circle back, to answer those people who say that they haven't gotten the information that would satisfy them, how do you respond to that?
I respond that these kinds of events are heartbreaking. To the extent that we can be transparent with our patients, we should be, and I believe that we are.
Courts pointed to agency and third-party websites that detail ratings, patient survey results, and statistics related to harm and deaths at specific military facilities and clinics. But we found the agency's Transparency Hub is hardly transparent, with no data found about adverse events at some locations and outdated news releases, reports, and policies on their homepage. The most recent post highlights high safety grades given to just 9 military hospitals, something courts cited during our interview, along with consistent recognition for a handful of facilities by the American College of Surgeons. But when pressed about the basic data we obtained about providers on the other end of the spectrum, those involved in discipline, he was far more elusive.
Give me an idea of the percentage of physicians and providers in the military healthcare system that are having these adverse privileging actions, this discipline taken against them.
Yes, let me give you some perspective on the size of our healthcare system.
I just want your perspective on the actual number of physicians and providers being reported to this data bank. Is it satisfactory to you to have 500 doctors or providers reported in that small window of time?
Joce, we have multiple sources of information about the safety and quality of our care.
To you, does that seem like a low number? Is that a high number? What does that amount of reporting say about the quality of the military healthcare system?
We deliver excellent, safe, high-quality care.
Court says the goal is zero harm, something he says the DHA tries to achieve through root cause analysis, looking at what went wrong in serious injuries and deaths, using data to look for trends system-wide, and then creating policies designed to improve healthcare quality overall.
We insist on high-quality, safe care, and so we will continue to deliver on that promise. Our patients deserve it. I'm one of them. Whether I was one of them or not, they deserve the highest quality, safest care that can be delivered anywhere in the world. And that's my commitment and our commitment to make that happen.
A pledge to those who put their lives on the line and their families. People who've told us the military system they trust with their health continues to put secrecy above those who serve.